Whooping cough, also known as the 100-day cough or pertussis, is a highly contagious respiratory disease caused by Bordetella pertussis bacteria. Initial symptoms present similarly to those of the common cold, including runny nose, sneezing, fever, and a mild cough. After 1 to 2 weeks, these symptoms worsen and can lead to severe coughing fits with a characteristic whoop sound. The cough can last for weeks or even months, and in young children can be deadly. Children under 6 months are too young to be vaccinated against whooping cough. The Australian Institute of Health and Welfare report that the most common complication from whooping cough is pneumonia, an infection of the lungs. They state that 1 in 125 babies under the age of 6 months with whooping cough will die from pneumonia or brain damage. Although people of any age can be affected by whooping cough, the highest rates are in children, with young babies at most risk from complications. In 2024, whooping cough cases in Australia surged, surpassing 57,000 cases for the first time on record. Professor Nathan Bartlett from the University of Newcastle and Hunter Medical Research Institute's Infectious Diseases Research Program explains that this spike is likely linked to disruptions in transmission during COVID lockdowns and low vaccination rates in adults. He states that these numbers are officially out of the ordinary. Professor Bartlett indicates that the resurgence of respiratory pathogens, including Bordetella pertussis, follows a time when kids were not going to school and had limited interactions with other children, reducing their exposure to infection. In Australia, whooping cough is a nationally notifiable disease, where diagnosed cases are reported to state health departments within the government. Regular outbreaks occur every few years, and we can see in this slide from the analysis by the Australian Institute of Health and Welfare that Australia has seen multiple outbreaks between the years 2000 and 2016. In 2009, the highest rates were reported in infants under the age of 1, whereas in 2011, 2015 and 2016, children aged between 1 and 14 years reported the highest occurrence. More recently, the Australian Centre for Disease Control has reported an unusually high number of whooping cough cases already in Australia this year. In January alone, almost 5,000 cases were recorded in the National Notifiable Diseases Surveillance System, with most of these reports for children aged between 5 and 14 years. Whooping cough vaccination programs began in the early 1940s in Australia. The Australian Institute of Health and Welfare's analysis of National Morbidity Database provides a snapshot of the impact vaccination had on the number of deaths per annum due to whooping cough, with the average number of deaths falling from 291 in the first half of the 20th century to just 2 per year for the past 20 years. The benefit of vaccination is clearly evident. Hospitalisation rates for whooping cough are significantly higher for infants under 1 year. This is influenced by infants' ineligibility to be fully vaccinated before the age of 1. Vaccination in pregnancy is the most effective approach to reduce complications from pertussis in infants who are too young to be protected directly from vaccination. Pertussis vaccinations have been recommended and available for pregnant women in Australia since 2013. McRae et al. Reported on studies that found women living in socioeconomically disadvantaged areas in Victoria had the lowest maternal vaccine coverage. They also considered the results of 21 studies of maternal pertussis vaccine coverage in First Nations women antenatally, which found rates of up to 20% lower than non-Indigenous women in the same position. McHugh et al. Also identified significant inequitable coverage of antenatal vaccinations among First Nations women, women who lived in remote areas, and women who lived in areas with higher levels of socioeconomic disadvantage. This study concludes that these known increased risk factors require strategies to ensure equitable delivery of vaccinations, which is the responsibility of the Australian healthcare system. Why is antenatal vaccination important? as well as offering protection to infants who are too young to receive their pertussis vaccination. A study by Danchin et al. Highlights that the vaccine decision-making for babies and children begins prenatally, with mothers who receive the vaccine while pregnant more likely to have their children vaccinated. Availability of maternal vaccines in public antenatal clinics were identified as a key barrier to delivery. Health promotion strategies predominantly involve vaccination promotion. The Immunisation Foundation of Australia offer resources to promote vaccination in pregnancy, childhood, and as required boosters. Whooping Cough Day on November 8 spotlights the threat posed by whooping cough and the simple ways people can remain protected throughout life. No Jab, No Pay is a national legislation that was introduced in 2015, where in order to receive Family Tax Benefit A or the government's childcare subsidy, children must meet immunisation requirements. This means children are required to be vaccinated against the diseases as per the age-appropriate early childhood vaccination schedule in order for the parents to be eligible for financial benefits. The No Jab, No Play legislation was introduced in January 2016, with all states in Australia except Tasmania, the Northern Territory and Australian Capital Territory implementing vaccination regulations within early childcare settings. In order to enrol in daycare, kindergarten or preschool programs in these states, centres must receive a child's current immunisation statement from the Australian Immunisation Register. In all states in Australia, unimmunised children can be excluded from attending in the event of an outbreak. State-based and national awareness campaigns are also targeting First Nations Australians in an attempt to reduce the gap in vaccination coverage between Indigenous and non-Indigenous Australians. Whooping cough is preventable and treatable. After 5 days of antibiotic treatment, children are considered no longer contagious and may return to normal activity outside the home. Vaccination is the best prevention and is the responsibility of parents, caregivers, and the Australian Government to ensure Australian children are safe from complications of infection.